So welcome to another episode of OneMDx, a video webcast series where we sit down with leaders shaping the future of the MedTech space here within Australia and beyond. Today, I'm joined by the National Sales Director from a company called MatOrtho. Alastair Richardson has joined us to talk today about the journey that MatOrtho are on here within Australia and beyond. MatOrtho are a British medical device company making a big impact in this space. Whilst they might not be the loudest brand in the market, their reputation for surgical innovation and clinical outcomes is second to none. From their Safe Knee, which is a medially stabilised platform, through to ReCerf, a ceramic hip resurfacing system, the first of its type to be approved by the TGA here within Australia. Today, we're here to talk about their commercial strategy for growth over the next 12 months and beyond, how they've been able to bring to life disruptive technology in a really competitive market such as orthopedics, and we'll also touch on talent and how they've been able to develop, nurture and attract top talent within, again, a very competitive market. I'm really excited to welcome today Alistair. Thanks ever so much for being so generous with your time. Selfishly, I've been quite excited to have you on. Not a huge amount of innovation often comes out of the UK from a MedTech perspective. So naturally, I was really excited to have you on to discuss your own journey, but obviously the journey that MatOrtho have been on over the last few years, and obviously what the future looks like for the business as well as they launch some amazing new products here within the market. So thank you ever so much for joining us today. We really appreciate it.
Thanks, man. I'm really looking forward to
it's
chatting
good.
with you today, Kim.
Absolutely. Cheers. No, really excited to have you on. Before I guess we get into the story of MatOrtho, I'm keen to understand a bit more about you and your journey. Can you tell us a bit more about your own career? Because I think you've got a really interesting story to tell. You've spent a huge chunk of your time within medical devices within orthopedics, whether that be trauma, joint replacement, and you've worked for some of the biggest medical device companies in the world as well. So give us a bit of an overview on your journey and ultimately what led you to MatOrtho.
Yeah, sure. So look, I started in medical devices in 2010 at a little company called Synthes. So I was one of the lucky people to go through a really challenging interview process at a company that was really focused and dedicated on two or three different areas. And I really tipped into the trauma side of things. So that was in 2010 and had a great entry into medical devices, some amazing leaders there that have definitely shaped, my career and actually still do today, who you stay in contact with. And it's so much about relationships in this business. So I had an amazing start in trauma and really just immersed myself in the whole medical device field and understanding what happens in an operating theatre, how you can add value to the surgeon group and the clinical staff there, and ultimately about how you can have great patient impact as well. So it was really, really good.
Yeah, fantastic. And as I touched on earlier, you've worked across large and small MedTech businesses, coming from DePuy Synthes and obviously Stryker, two of the largest orthopedic companies in the world, to a smaller organization like MatOrtho. What has been the biggest shift, would you say, stepping into a leaner, more agile business like MatOrtho?
Yeah, it's interesting. So working exactly at two big companies, multinational ones, there's so much resource behind these companies, and they're very commercially focused and market driven as well. So what you have in those types of companies is a great engine behind you, so to speak, that you can then provide a swath of solutions for your customers and real marketing behind it. One of the things about a smaller company, it's a bit more agile, but you also have your resource depleted in a lot of ways. Right. And whilst that might sound like a negative, it can actually be a positive because you can really shape things and tailor things for your particular market and certainly for your customer. And those things are harder at bigger companies. So, one of the things that attracted me to a company like MatOrtho was, the agility of the company, but then also being able to shape, the future, particularly in the ANZ market over here.
Yeah, no, absolutely. And it is an amazing story to tell. And, for the listeners listening and for those watching, need to be very clear that OneMD are very much an product agnostic business. But as I say, I think the story that MatOrtho have to tell is a really interesting one. So we'll kind of dive into that in a moment. For those that don't know, how would you describe MatOrtho's position in the Australian market within orthopedics right now?
Yeah, so I think MatOrtho is a really little company that, as you said, it's a UK held company, but a significant part of our business is over in the ANZ market. And for a small company, the actual impact it's had on orthopedics is really huge. If you think about the medial stabilized knee, beginning over with MatOrtho and originally being Finsbury, which MatOrtho was born out of.
Yeah.
Over here in the Australian market, we really have had a huge focus on the hip resurfacing side of things, but then also the medial pivot, side of the market. So I think what we're known for really though is that hip resurfacing with our Adept product, and then more recently with ReCerf as well.
Yeah, and again, I think the business has enjoyed reaching some pretty significant milestones over the last 6 months.
Yep.
With TGA approval, I believe in December 24 for ReCerf, and then receiving CE marking just this month?
Yeah, just this month
right?
we've received that for the UK and Europe. So just another huge milestone for ReCerf. We obviously had TGA approval in Australia first and foremost, and then in March this year having plaque listing as well in the private, which has been a significant impact for our business as well.
So what does that mean, for a company like MatOrtho to achieve those milestones, which, we know the amount of work that goes into getting a company to that point. There's a lot of blood, sweat and tears, but, what does that look like now for the next 6 months and beyond?
I think it's a really exciting time at MatOrtho. So with ReCerf now being, prosthesis listed, I suppose the impact it has now is when a patient, decides that they're interested in resurfacing and a surgeon thinks that they're the right indication and applicable for it, they can now get that rebated in a private hospital, which is a really important milestone. Before that, a patient would have to pay out of pocket if they did want to go down the resurfacing route. And for a lot of patients, that's not possible, and for surgeons. So historically, while a surgeon may have thought this is a great product, I think the patient would be really suitable for it. They haven't been able to have that option until really recently. And how do you get there? It's a lot of effort and resource and money and cost. And as I spoke about at the start, for a small company like MatOrtho, the amount of people that have had to work behind the scenes for a number of years to get it to this point has been really important.
No, absolutely. And orthopedics, it's such a competitive space. There's lots of different players from small organizations like yourselves through to big multinationals like Stryker and J&J.
Yes.
How do MatOrtho differentiate themselves from your perspective in the market? And you're really well placed because you've worked for many of those organizations that I've touched on.
Yeah. So look, even though we work in the hip and knee space like, J&J or, Stryker, where I would say is we're really focused on being a boutique company, and we can really put the patient and the surgeon at the center of what we do. So we want to be known as a bespoke company that can offer solutions and also training and education pathway that's going to fit and tailor the customer. We want to keep that customer at the center of everything we do. And we know with something like hip resurfacing, as it comes back into fashion, and there's a lot of excitement around it, a huge proponent of that has to be the training and education that we provide that is underpinned by that. It is a very challenging operation, and there's a lot of learning that needs to go on with that. So a huge part of my job is to actually build this hip resurfacing community in the ANZ market and connect people from all around the country to make sure that we're sharing best practice. We've got some of the best hip resurfacing surgeons in the world, and we have some surgeons who are very new to it. And so a huge part of my role that I'm really passionate about is building that community together.
No, absolutely. And what has been the response from the surgeon community since obviously the announcement back in December where you received that TGA approval? Yeah,
so look, I've been involved in a lot of big launches over the time. I remember when Mako Robotics came with the total knee application and what that had, and for me, I can honestly say I've never seen a response like this within the Australian market. Surgeons wanting to understand more about hip resurfacing, specifically around the product on ReCerf and how it can benefit their patients. So such an exciting time to come into the company, but also a lot of responsibility with that. Knowing that hip resurfacing has been a challenging operation, and it has had a checkered past over the history. So I think doing it the right way and making sure that we're partnering with surgeons to train them responsibly to make sure they're having great patient outcomes early is really important.
Yeah, so education and training seems to be a big focus for you. Outside of education and training, how have you managed that launch, and what has that go-to-market strategy look like?
So look, ReCerf's been around in Australia for a couple of years. We had a few of the really early users within the Australian market here, which is great. So initially the rollout has been just to the small cohort of surgeons who have been part of some of our landmark studies. We've actually just released the 5-year results of the original ReCerf patients that were done. And, some of the results with women and also head sizes smaller than 50 are incredible.
Fantastic.
So we're going to see more and more of this literature and data come out that's going to really be supporting, ReCerf launch. As far as where we are now, we're really at that next point of introducing resurfacing to a lot of different customers now. So some are coming back to resurfacing, after 10 or 15 years. We've had a lot of hip preservation surgeons who are interested in, adding this into their armamentarium around how can they offer solutions. Also, direct anterior. Yeah. There's a lot of interest around that in Australia. As you know, it's such a growing market within our community here, and looking at, where that sits potentially within the hip resurfacing space as well.
It's an exciting time, no doubt, not just for the business, but I think for the market in general.
Yep.
What changes and I suppose evolutions have you seen since you came into orthopedics, all those years ago to what it looks like today?
Look, I think in the Australian market, they really are visionaries here. If I think about the differences with early adoption of robotics, certainly early adoption of alignment within here as opposed to other markets that are slightly more conservative. So I'd say the Australian community, they're really on the forefront of enabling technology, new alignment philosophies, and really pushing the boundaries of what's possible. We know what's coming in now is that early, joint stay is 24 hours. We know that we're going to see more patient throughput. How certain surgeons are partnering on different programs with private health insurance as well. So these things are changing rapidly within the market. And I think for companies is how do we position ourselves to capitalize on that, but also partner with the customer.
No, absolutely. And if you look ahead to the next 12 months, it's obviously a key time, for yourself and the business, relatively new in the role, but obviously exciting time with new products being, launched to market. How do you fundamentally equip your sales team to go out and compete again in what is probably one of the most competitive spaces within MedTech?
Yeah, it's a great question. I think it's about, finding the right talent and then making sure that you're empowering them to go out and have those conversations. And, I think a big part of what I love doing and what I'm passionate about is coaching, and that's through my personal life as well as my professional life. Yeah. And so, working with people within my team and helping coach them and come out and have those challenging conversations at times, but really empowering your team and helping growing and developing them. And if you think about your workforce and your team, that's what people are really looking for. They're looking for a place where they can thrive and grow, but then also where, there's great coaching and where they have the opportunity to win as well.
No, and it's a really good point. And as I said, we spoke, I think, just before we started the recording, that finding talent in this market now is arguably harder than it has ever been. When you're hiring, what do you tend to look for within a particular individual to determine whether they are going to truly thrive in this space or perhaps not?
Yeah, I think, and I think I've interviewed a lot over the years, and there's no perfect candidate, and you never get it right all the time. But for me, in that hour I have with someone, I'm really trying to understand what are their intrinsic motivators and drivers, what are their passions, and then understanding what their natural talents are as well and their strengths. So I think if you can tap into those things when you're meeting people and be curious about it, then you can understand whether you've got the right candidate in front of you. And a big part of it is they can be really successful in sales, but they may not be the right cultural fit for your company. And that doesn't mean they can't sell. It just might not be the right fit from a sales perspective. So I'm really looking for that internal driver, like what is getting that person up in the morning, what's keeping them out there when things get hard. We spoke before about don't give it to me when it's easy, but really give me, what do you like when it's hard? What do you like when you have a lot of no's? So, getting examples around how people have navigated those is really, really important. But as I said, the finding the right talent out there, it's highly competitive. You need to make sure within your team you have a great program that you can help build and coach people, and you can show them also a career pathway and what they're going to get back from working at a place like MatOrtho. Yeah,
absolutely. And sometimes those things can be the difference between hiring someone and them going to a competitor.
As you would know.
As we would know. Exactly. As we would know. Has the profile then, do you think, of what a good orthopedic sales rep changed since you came into the industry to what it looks like now? Do you think the characteristics have shifted, or has everything that you've sort of touched on remained relatively constant throughout that period?
I think some things have shifted, but I think the core things haven't. So if I think about the key things within the industry, being able to develop great relationships, being very strong on your product knowledge, I think those things, being reliable, being dependable and consistent, those things have always been there. So I think, when I started, they were the key ingredients that you really needed to build trust with the customer and making sure that they know in your hands everything will be all right when they hit roadblocks. I think some of the new things that have come in, think about enabling technology, I think that's really shifted the type of people that we're attracting into medical devices, but then also the skill set that you need as well. It is really different these days to 10 to 15 years ago when we were doing, more instrumented knees and a bit of navigation as to where we are now. So I think you have to be equipped with more skill sets probably than you did 10 to 15 years ago. But I think that the key on a great sales rep, the foundations of what you need is still very similar.
Yeah, it's interesting because, we obviously speak to a lot of people that are looking to enter the industry, for the first time. Our job is obviously to determine whether they have the right attitude, the right characteristics. You never quite know until they're in the role as to how they're going to perform. And I think from our perspective as well, the profile of what a medical device rep now looks like is slightly different perhaps to what it looked like a few years ago. I think there's certain companies now that are certainly attributing a lot more weight to characteristics and innate ability as opposed to simply what's on the resume and what previously they have perhaps been involved with at a clinical level. So there's definitely certain shifts.
It's a shift
that we've seen. So as I say, it's a constant evolution, and I think our observation is finding good people in this space, as I say, is arguably harder than it was, when we set the business up sort of 5 years ago. But again, we're huge advocates for the industry, and I don't think there's too many industries like medical devices that are as fulfilling and as rewarding as the industry that we're involved with.
Yeah, I'd agree with that.
In terms of, I suppose, your leadership style, you've been in leadership now for a number of years. How has your philosophies changed over the time that you came into management to what it looks like now?
Yeah, I think it's like anything. It's a real journey, and you need great people around you. So I've had some amazing mentors, over the years. If I think about people who have helped shape my, career from a leadership perspective, the Gary Mitchells, Nick Krabazanovsky, and over at probably Striker, your Matt Malones, James Doyle, these types of people who have really helped shape, who you are. But ultimately, I think it's a lot about your experiences that you learn from, and being a really humble leader. And, I think at the start, I probably felt like I had to have all the answers to everything, and that I had to do everything. And then I think over time, as you reflect on that and you get feedback from certainly, the coaches you have around you and also your staff is really important. You start to, learn to trust in people and probably let go a little bit more and then work on critical things, like setting strategic direction, for the company in the future. And I think they're the types of areas where I'm trying to lean into more now. But I think having a lot of trust in people that you're hiring people for certain roles, and you have to give them, the trust and the bandwidth to go out and do those things. So, I don't think, leadership's something that I've got it one day and I'm the perfect leader. I think you're always growing and you're always trying to become a better leader for people. But again, it's something that I'm really passionate about. I mentioned before about what intrinsically drives you and motivates you. And for me, watching people learn and grow and helping them build a career is something that intrinsically drives me. So when you've got that type of compass on trying to help people, and that's my starting point, I feel like I can connect with people and hopefully get the best out of them in a role.
Yeah, absolutely. Has that changed over the years since you first came into the industry? I suppose, the idea of what management is and looks like versus then when you're in the role. Yeah,
absolutely. I think, you have this idea of management that people understand like they've got everything and they have all the answers. And then very much reporting and doing, like a hierarchical, this is my boss and this is your boss. And what you realize and understand is you keep going up further. It's around the relationships and the influence you can have across the business. And a great leader can influence across the business. And it's not so much the people that that your team you're working with. It's actually helping influence across different parts. I think across the commercial business or across the marketing business. How can you partner with different parts of the business to help your team? And ultimately with my team, I feel like I'm representing them and I'm trying to help support them. So in a lot of ways, that's servant leadership. I feel like I'm trying to work for them and get the best out of them that I can. So I think if you meet people with that and you're genuine and you can build trust and you can show people that you care about who they are as people, not just, who they are for MatOrtho or for Striker. I think that's where you can really, engage and get the best out of people.
Yeah, it's interesting, people that I've spoken to in similar positions to yourself, I think the one theme that comes through is you have to be selfless. Yeah. It's about the team first and foremost. It isn't about you and your own achievements. It's about what you can do to elevate and empower the team. And that seems to be a real consistent theme. So for anyone listening that perhaps has aspirations of moving into management and has a concept in their mind as to what management looks like, I think the first, question you have to probably ask yourself is, am I that person? Can I be someone that is focused on the team and can I be selfless ultimately?
And it's often not your highest performer either. And that's that's this myth of, my highest performer in sales is going to move in and be a great leader within a team. And it doesn't mean they won't, but I think that, when I'm looking across my career, a lot of the highest performers that I've, been involved with, they weren't necessarily the best leaders either. So I think that's an interesting watch as well on actually who you're bringing in. And it comes back to that. What is your intrinsic motivation to lead people? Is it about you or is it about helping other people?
Yeah, absolutely. And I guess just coming back to, MatOrtho and your environment that you're working in at the moment, obviously they're a British organisation, based in Surrey. Australia's a long way away from Leatherhead. How much autonomy, I suppose, are you afforded to, make decisions and drive the ship in the way that you want to?
Yeah, I mean, coming into the business, obviously my boss, David Clapcott, lives over in the UK and the first 6 months has just been amazing. Like talk about great leaders. David Clapcott's an incredible leader. And Oriel, who's is the interim CEO at the moment. So, I felt like at this company, I've had great support in the first 6 months, but then also enough autonomy to go out and understand the current state of the business. Where are we as a company right now in ANZ and globally? And then, how do we set that direction in the future and where do we need to go? So, I felt really that, I suppose, love, for want of a better word, from the guys in the UK and some terrific leaders within this business as well. And, as MatOrtho continues to evolve and, where we're going as a company is going to be really interesting over the next couple of years. And that was part of what attracted me to this business as well.
Yeah, absolutely. I mean, as I say, these types of opportunities that you're in, they don't come around very often. And I can talk from experience.
Yes.
What does your vision look like for the business here in Australia over the next sort of 2 to 3 years?
Yeah. Oh, look, we're going on a journey. There's no doubt about that, in Australia and globally. And I think historically where we've been as a business in MatOrtho has been an R&D, company. And where we're really shifting towards that transformation is more to a commercial company. So I can see in the Australian market where we're really looking to head to in those two areas is the hip resurfacing space. You only have to look at the joint registry to see how small it is at the moment. It is significantly growing. So where I see us in the next couple of years is really owning that hip resurfacing space. That's an important area that we want to make sure when people think about, hip resurfacing, that they're thinking about MatOrtho. We know also, where we're going as a business around the safe side of things with our knee. It's critically the medial pivot market is really, we spoke about innovation and early adopters. We know that the Australian market's moving this way. For us, it's how do we capitalize on that when we've got such a strong historical data around our knee, but knowing that we need enabling technology as well. So that's something that I'm really interested in, and the businesses as well, as how do we partner with enabling technology to complement, great products that we have.
Yeah, you touch on enabling technology, and I think that's true of a lot of subspecialties within medical devices. You look at spine, you look at neurovascular, the technology that's coming into those spaces, but probably no other specialty is as entrenched in enabling tech as orthopedics. And, I've not worked in the space now for 5 years, but it's just evolved so much even within that period of time. Probably quite a lot.
It's rapidly.
It's rapid. It's really quite hard to kind of keep tabs on what's happening. What do you foresee to be, the major changes to the market over the next few years? Do you think enabling tech will continue to essentially drive change as much as it has done over the last sort of 5 to 10 years?
Yeah, I think the next few years, will be. You always hear this. You underestimate, the change that can happen in a big period, but in a short period, it can shift. So I do see robotics, continuing to probably drive and enabling tech to drive the orthopedic space. But I do think also the next probably bit is around the data and what we're doing with that data as a company, and how that's then going to shape, either patient outcomes, looking at how we can improve those. We know that type of information is really critical for surgeons and also big, device companies as well. So, there's lots of new technology that's coming out. It's not just about robotics now. It's around that patient care and having the connection between, what's happening at someone post-op and at 6 months, and what's actually happening to them, for that first 24 hours, in post-surgery as well. So there's so much new technology that's coming out, that's being adopted. And as I said, it's really hard to keep up, and it's really rapid. And I think, the companies that can take advantage of that and capitalize on that are probably the ones that are going to drive forward. We know in the Australian market, costs will continue to come down. And so the companies that can continue to grow and innovate, I think, are the ones that will win.
And what about the customer base? I mean, we can talk obviously about how rapid the market is shifting. What about those, end users essentially? How are they responding to these changes from what you've seen?
Yeah, so I think, the type of surgeon that's coming out now is much more focused, I think, on their marketing and how they can build their business and their practice up in Australia. And I think that's really critical given how competitive the landscape is. So as a company, or if you think about it as a surgeon, when they come out, they've done all this training, but then they need to learn how to actually build a business up. So that's a real challenge. So I think, again, coming back to, a really strong device companies that have done well over the last few years is how do you offer solutions and to those problems that some of the surgeons are having. And coming out now as a surgeon is really challenging. It's like, how are you going to build your practice up, and who are you going to partner with? And you've got so many things that they need to work through. And I think, the companies that are doing well are seeing those problems, and they're helping solve those for surgeons.
So as a business then, when you're looking to, work with a surgeon or a new customer, or even, target new customers, is that something that you're acutely aware of, that, the needs of the surgeon has changed, not just from the metal and plastic that they use or have in their hands, but everything else that goes around it? And is that something that you speak with your reps about on a weekly, monthly basis? What does that sort of look like?
Yeah, so I think that how you, particularly with something like hip resurfacing, is how do you support a surgeon with that, and what are they going to need? What is the patient going to need?
Right.
And so a lot of the things that we're building out now, that collateral information that's going to help the patient pre-op, post-op, like what do they need? They're things that we're providing for surgeons. We spoke a bit about that resource being quite limited. So in a way, that can be a good thing, because you get really, really narrow and sharp and focused on what you need and then what you don't. And it's often actually saying no to things is the harder bit. But for us, it's making sure that we have enough, collateral and information that our surgeons feel confident that they know what they're doing, that they can position themselves, within the market the right way, and that also critically patients have the information that they need when they're considering a medical device. And patients are so much more educated now on what's going in their body. They want to know what it is. They want to know the results of it, and making sure those things are available for surgeons to share with their patients is really important.
Yeah, no, that makes a lot of sense. And you've touched on, I guess, one of the major challenges of a small business being resource. There's obviously lots of opportunities for MatOrtho over the next, 6 to 12 months and beyond. What are the main obstacles that you feel as an organization that you're going to have to navigate?
Yeah, like I think first, you mentioned it earlier, we're competing against some really big companies that are really well resourced. And often the challenge is that, you're trying to compete on their battleground in a certain way. So I think the first thing is you need to be true to what your strengths are and where you're going to lead, you're going to win. So I think with us, knowing that we're a boutique company, that we can offer a bespoke experience, I suppose, for a surgeon is really critical. There's a real personal touch that you get when a surgeon wants to come and engage with MatOrtho, and that can feel different to big companies. Having said that, we know that some of the solutions we have, coming down are going to really, I think, align with what surgeons want over here from a knee perspective. And we know that in the hip resurfacing space, we have this incredible product, that's become available for surgeons. But again, it's how do we partner with them to make sure that that's getting to as many patients as possible.
Yeah, no, absolutely. And I think for those, just coming back, I suppose, to, the orthopedic market in general, for those people that are perhaps looking to enter orthopedics for the first time, either from another specialty or entering the industry for the first time, what advice would you give to those people that are looking at orthopedics as that's where I want to be? All the research I've done is pointing me towards that direction. It's not easy to get into, as we know. It's very competitive. But what advice would you give to people perhaps looking to make that first step into this space?
I think, showing great initiative when you're looking at the industry. And that's not just about getting on websites and looking at products. Sure. It's more around, can you get into theatre somewhere? Right. And, can you actually have an experience in theatre? And who are you talking to within the industry? Have you connected with people? What are you driving? So I think, going beyond just looking at websites and talking to recruiters, I think you actually need to go out and drive initiative yourself and really understand the market because whilst it's an exciting place to get into, there are some real challenges as well. And you've got to make sure that you're getting into these things for the right reasons and that you're in it for the long haul, because you're thinking about coming into this industry, what you don't want to do is be at 2 or 3 different places over 2 or 3 different years. And it's such a small industry. It's very relationship focused still, and you want to build your brand within this, this industry. You've got to be really careful with your career. Yeah.
And if you reflect on your time in orthopedics and those that you've worked with that have gone on to do amazingly well, whether it be sales or even management, what would you attribute to be the key skill sets that they've all sort of been able to demonstrate?
I suppose there's no one thing in particular, but what I would say is being able to build relationships and being able to influence without that authority is really critical. I think you need to be able to inspire people. I do still think people want to be inspired and feel like there's a leader that they're motivated to work with as well. I absolutely think that's part of it. I think, leaders within that I've met who have been really inspiring are also ones that, have that humility of, again, they don't have all those answers, but they want to partner with people and try and find solutions and ways forward. And as I said, I've been really lucky to work with, I think, some of the best, leaders within this MedTech industry. And, what I've always tried to do is, stay in contact with people and also, making sure that I'm available for people as well, through the industry. And I think it's so much about connecting people within here. It's such a small game.
Yeah, no, absolutely. And I think, as far as your own journey into management, if you reflect on your time, what would you say have perhaps been the biggest lessons that you've learned over the years coming into management?
Yeah, so I think you probably learn from your failings, as much as your successes, and absolutely, I've had some challenges over the years, and you reflect on those and you learn from them. So I think, I said leading with that humility and that I'm going to grow from those experiences is important. I think having a leader that is going to give you enough autonomy and rope to go out and try new things has been really important for me. Okay. And that's something in this role which I've really felt like I've thrived in. Good. And that's something I try and instill in other leaders as well. It's okay to make mistakes and go out and try it. Don't be afraid to try things.
Yes. Yeah.
And that going out and trying new things and daring is really what helps you learn and grow, because you continue to push what you think what's possible and what you think you're capable of. And often I think that we're capable of much more than what we think. But we don't know until we step off the ledge. Yeah. And, for people who aren't, quite sure, to stay in a safe space is comforting at times, but there are going to be times in your career where you're going to have to jump off a ledge a little bit and just, get your feet swimming again, and you got to step off the deep end of the pool. And for me, you don't want that to be all the time, but there's been points in my career where I've had to step off the ledge of the pool and, start learning how to swim again. And this is absolutely one of those moments, now, but I feel like they're the times where you learn and grow. It's when you're under the stress, and that's when you find out about yourself, Kim, as well. And they're the real challenges that you look back on. And I think you want those challenges because that kind of defines, who you are and what's possible. And I think that's when you really start finding out about yourself.
Yeah, no, I couldn't agree more. I sit here with a wry smile because we speak to so many different people that are probably at the precipice of making a major life decision, whether it be moving companies, moving roles, whatever it might be. And we're having to have real deep, honest conversations with these people and giving them the confidence that actually, like you say, making the decision is only going to lead to growth. It might not feel like it right there, right now, but ultimately good things happen, like you say, when you're stressed and under pressure.
Yes.
I've experienced it leaving the confines of a big MedTech company to set up a business from scratch, and it's really nerve-wracking. But as I say, I wouldn't change it for the world. We've learned a lot over the last 5 years, as I'm sure you have, making the moves that you've made. And I would advocate for anyone, or to anyone, I should say, if you're feeling like change is needed, commit and dive in with both feet. You can only look forward in those circumstances. In terms of, I suppose, your own leadership style, I'm keen to understand what your sort of philosophies are. Has that shifted or changed over the years, and how would you describe your leadership styles, and what does that look like?
Oh, for me, look, I'm sure it has. It's changed a lot, as I've kind of said over the years, and it evolves through your experiences, and not only your personal experiences, but I think who you become in touch with and who you learn from. I'm a huge one for continuing to learn and build on what I am already. Like I certainly don't think I'm the finished product as a leader, but for me, coming in and connecting with people and building trust is critical. So I'm someone who, as a leader, really want to get to know the team and who I'm working with, and understanding, as I said, what their strengths are and how I can work with them best and get the best out of them. I feel like I live in the coach space. As I said, I do it in my personal life. It's a real passion of mine. So those types of things, that's what lights me up. Okay. Where I've evolved probably in the last couple of years is, learning how do you set strategic direction, for a business, and, when are you looking 3 to 5 years into the future? What does that look like, and what are you going to need? So that's probably where I've gone on a journey the last couple of years. So probably shifted away from living in the here and now, and then looking into the future as to what might be possible and what we might need to get there as well.
Okay, no, fantastic. Thank you for that, Alan. I think it's a good time to sort of touch on what message you've got to perhaps people in the market that are looking at MatOrtho and are liking the work that you're doing, and can perhaps see you as an employer of choice. Sort of what advice would you give to somebody that perhaps really wants to be part of MatOrtho and the journey that you're on?
So look, MatOrtho, I can't think of a more exciting time to join, a company. It's steeped in history from Finsbury as well. And you think about the amazing work that Mike Duke has done, and he's still very much part of this journey with us, which is really exciting. But, MatOrtho, as I said, it's a very small boutique personal company, and we just have these incredible products. And what we're trying to build here is that culture of people who want to come on board and be part of this journey. There's only a few times, I believe, in orthopedics where you have a wave like this that we have at the moment. It doesn't happen very often. So for me to come on board, that was one of the reasons why I wanted to. And I just can't think of a more exciting time if you're in sales and you're driven by that type of thing, and you love having those conversations that are quite complex with surgeons, but really engaging. I think this is a great time from a product perspective. What are we building here culturally? As a team, we want to be a place that's fun to work at, a place where you can learn and grow as well, and you can build a career here as well. MatOrtho is incredibly invested in its people. We're looking to bring more people on. We are on a growth trajectory that I don't think another orthopedic company is on at the moment as well, and that won't be slowing down. So, always looking to bring in top-end talent, always love having conversations, with people, within the industry like yourself and others.
Fantastic. No, I think that's a really good, topic to finish on. It's clear that this is a really exciting time for you and the wider business, as you look to launch, truly innovative products. As I say, there's a real heritage to MatOrtho. There's such a solid story there to tell. And I think if you are the type of rep that, like you say, is motivated by those in-depth clinical conversations and you're motivated by point of difference, then it's an amazing opportunity, an amazing environment, that presents itself. And I think it's been really interesting just to hear the journey that you've been on, but also the journey that MatOrtho are on here locally. I think the potential with ReCerf is huge, but then as I say, the focus on the safe knee and what you can do to truly put that at the forefront as well of surgeons, I think is really exciting. So yeah, it sounds like a really interesting and exciting time for where you guys are at as a business. And it's been a pleasure to sort of play a part in the growth of the business over the last few years and hopefully beyond. But Al, I just want to thank you for your time. It's been, again, really, really valuable to understand a bit more about the journey. We'll continue to advocate for the business in the market. And we really appreciate you being so generous with your time today.
Thanks, Kim. Really appreciate it. And thank you, listeners, as well. Love talking to you today.
Appreciate it. Cheers now.
Bye.
Bye.